A little bit of background on Respiri. I mean, we are a medical device eHealth organization that specializes in devices and platforms in respiratory health. We are there to help support physicians really provide better service and better quality of care to patients when they leave their care. Respiratory disorders such as asthma and COPD, chronic obstructive pulmonary disease, are the third largest disease state to afflict the human race, behind cardiovascular and diabetes. And yet today, when a patient leaves the care of their physician, that doctor has absolutely no idea what is happening with their patient out in the real world, whether they're being controlled, whether the program and treatment paradigms that they put in place are actually working, and much more importantly, are they heading towards an event, an exacerbation, or a hospitalization? And it's probably one of the reasons why, for instance, in the United States, COPD results in the deaths of about 250,000 Americans every single year. Our predominant area of business and our sole focus is the United States, and that's what I'd like to talk to you all about today, because we've made some significant progress in that marketplace where we only launched our business about 18 months ago. So everything we're going to be talking about today has happened in a very, very short period of time. And as a guy who's got quite extensive experience in healthcare, starting in big pharmaceuticals, working for Merck & Company and Pharmacia, getting something done that quickly in a behemoth market like the United States is quite an achievement. Next slide, please. And next slide, please. And again. So everything that I'll be talking to you about today are things that are happening. These are not aspirations that we have, but these are things that our business is currently delivering. We are ready for commercialization, and we're already commercializing. We have a wheezo device, which is our respiratory lead device. It is FDA approved, which means we can market and sell the product, which we currently do. The device is validated. We know that the device works, and we know that it works as well as a physician with a stethoscope in detecting abnormal breath sounds, which is so important when you're talking about patients with respiratory disorders, and very important when you look at how the utility of our device, which is in the remote patient monitoring space. We provide doctors with the information they need to be able to understand how well their patients are tracking when they're not sitting in front of them, and importantly, do something about it if things are deteriorating before it becomes an issue. The platform that supports the device as well has been validated and is a validation around keeping patients engaged and keeping them on program. The Remote Patient Monitoring Program, RPM, is one that's been tested by our organisation, both here in Australia and in the United States. Patients are highly compliant. We have a compliance rate of 83%. Now, to put that into perspective, as an ex-pharmaceutical guy, if the people that I had put on my tablets were still taking those tablets in 6 months' time, half of them, I'd be a happy camper. We've got a compliance rate of 83%. So we're very compliant. And that's really important when we start talking about the reimbursement rewards that are given to physicians in this space. We know that the program has a positive impact on patient outcomes. That's proven. And we know that those patient outcomes result in a reduction in hospitalizations and exacerbations. And that obviously leads to cost benefits, which is so very important in any healthcare system, but particularly the United States. The US market is rather unique. Apart from being the behemoth that it is, it reimburses remote patient monitoring and reimburses it to physicians. It's not me that gets paid for the service, it is the doctor that gets paid. And the services are reimbursed by CMS, that's the Centers of Medicare and Medicaid Services, and it's reimbursed right across the country. And it is important to note that physicians in the United States or healthcare organizations can outsource the entire program, that is the patient monitoring, patient interaction, to a third party. And that third party can be ourselves or our partners. We have got marketing and sales partners in place now that deliver remote patient monitoring services, which includes patient clinical engagement And one of the things that I'll be talking about in today's presentation is our recently announced acquisition of one of our partners that we've been working with for well over 12 months. The commercial pipeline is very strong. We have 10 healthcare organizations currently on our books, and they are putting patients on programs and have been paid and are paying us for those services. So we have a revenue stream in place now. So our challenge really is to scale that particular revenue stream. Patients are being enrolled on wheezo remote patient monitoring as I speak. And we have a very rich pipeline. We've got more than six imminent deals in place right now. And they are pretty close to being finalized as I speak today. Important to note that we've also got a very broad list of specialists that have taken wheezo on board with the remote patient monitoring services and across numerous states. Over 14 of the United States are currently operational for us from a remote patient monitoring perspective. We have additional healthcare partners, as I said, above and beyond Access Telehealth, who we will be acquiring. And as I said, our business model is currently delivering revenues. We make money from selling our devices to our partner organizations and from a monthly fee for service per patient per month for every patient that's put on wheezo for the remote patient monitoring services. So there is a recurring revenue stream that excites me greatly about the business model that we have. As I said, we have an end-to-end solution now with the acquisition of Access, which I'll go into a little more detail about. We've got a team that knows what it's doing. Some would argue that I know what I'm doing as well. It's not the first time I've ridden this pony, so it's something that I understand very well and have done work in the United States and across the globe in healthcare, and particularly in remote patient monitoring. As I said, patients are being onboarded. We know the program works. We know that reimbursement is paying for the service that our wheezo device provides physicians. And we know that we have a number of remote patient monitoring partners in place beyond the one that we're purchasing. We are scale ready. That means we can handle the volumes that we believe we're going to be generating over the next 12 to 24 months. And we've got sufficient inventory, over 20,000 units of wheezo that's all paid for, that's ready for us to use as we grow our footprint in the United States. Next slide, please. The journey's been a great one and one that's happened rather quickly. There's always pain involved in all these sorts of things, but our first customer was secured early last year, and that was Michigan Children's Hospital, who are owned by a large New York Stock Exchange listed healthcare provider called Tenet Health. THC is their ticker code. They own over 62 hospitals across the United States and over 120 outpatient clinics, and have basically indicated to us that when we get the remote patient monitoring solution with wheezo correct at Michigan, it's certainly something they're looking at mandating across their organization. So that's a very exciting first customer that we've picked up, and we're working towards making sure that we get that as successful as we possibly can. The remote patient monitoring program for children at Michigan has just been awarded the right to present at the Quad AI conference in February in the United States, and that's the American Academy of Allergy, Asthma, and Immunology, a keynote area for people who are expert in this areas. And where we've been asked, well, we haven't been asked, but Michigan have been asked to present the results of this particular program, which is very exciting. Over the period of time, we're now at a place where we've got 3,500 patients currently contracted, be onboarded. We've secured business with other major clients, including Arkansas Heart Hospital, which is the largest customer, so one of the largest privately held heart hospitals in the United States, and a number of other major institutions across the country. We're currently also in discussions with quite a number of health insurers. Now, this is really exciting because it's in their interest to move healthcare from high cost areas of delivery, which is hospital and tertiary care, to lower cost provision areas such as the home. So remote patient monitoring is very, very important in helping achieve that. Importantly, we just recently appointed a head of US operations, Will Sigsby, who has extensive experience in healthcare in this space, and certainly one that will help us accelerate our growth and also help us integrate Access Telehealth after the acquisition. And the acquisition is something I'd like to talk to you all about today, because today this is something of a company redefining moment and one that will accelerate our presence in the United States. Next slide, please. And again, please. So Access Telehealth is a partner of ours that we have been dealing with now for over 12 months. They have been successful in working with us in securing business for remote patient monitoring, not just for wheezo, but in other therapeutic areas such as cardiovascular disease, diabetes, and also obesity. The acquisition of Access will make Respiri the first Australian company to deliver an end-to-end remote patient monitoring service in the United States to the United States healthcare providers. They are someone that we know very well after 12 months, so we know what it is that they can do, we know what they're very good at, and we know that they have world-class solution when it comes to remote patient monitoring, delivery, and also persistence for patients. Important to note that our wheezo device has been the device that they've used to differentiate their entire service as remote patient monitoring to their clients, and that will not change moving forward with the acquisition. Now, the reason for the acquisition, they're pretty straightforward. The economics just make sense. Today, we make about $10 to $20 per patient per month for each patient put on a remote patient monitoring program with wheezo. The acquisition of Access will improve that to somewhere between $70 and $100 per patient per month, and not just for wheezo and respiratory, but in cardiovascular, diabetes, and also obesity. The entire business plan and revenue stream is underpinned by reimbursement. And that's really important, because that was one of the things that doesn't exist in all countries around the world. Important, the acquisition actually reduces the number of patients we need to break even to about 9,000 active patients on platform per month, down from 30,000 originally. As I mentioned, they deliver services in more than just respiratory disorders. So the total addressable market that we now play with since the acquisition of Access Telehealth grows from about 50 million respiratory patients in the United States alone to well over 150 million patients in the United States. And it really is important to note that when we deal with a customer, that customer doesn't want a remote patient monitoring solution for one disease state. They want it for their entire organization. The acquisition of Access Telehealth helps us address that and take advantage of that. Wheezo, as I said, will remain the differentiator for us that opens doors for our business, and does so for Access right now. And that is not going to change moving forward. It just gives us a differentiation from other remote patient monitoring organizations that have none of their own IP. And we have a very, very strong customer pipeline, as I've described, with Access and also existing customers. So we've got a revenue stream that results from this acquisition as well. As I alluded to previously, we've got a team that's done all this before and are confident in doing it again. We've acquired an organization who's best in class when it comes to delivering remote patient monitoring solutions and achieving the goals necessary for doctors to be able to claim reimbursement better than anybody else. Next slide, please. So basically, this is really on track with achieving the goals that we set out with in late 2021 when we launched the United States. Today, we are a eHealth SaaS organization with medical devices that allow us to provide remote patient monitoring services through partners for respiratory disorders. The acquisition, which creates our future state, sees us now have a diversified, full-service remote patient monitoring solution to provide to customers, differentiated on the back of our own IP in wheezo, but also being able to deliver the other disease states as a single solution for our customers. So this is something that really is unique Respiri, but also unique for the US marketplace. Next slide, please. And again. So as I said, we have a situation where we have an end-to-end remote patient monitoring solution that is differentiated on our remote wheezo device. All the integrations required to work with our hospital clients and accountable care organisations have been put in place. So this is something that will streamline the process. Our margins are improving significantly, and we've got the infrastructure in place now to be able to scale to meet our forecasts in onboarding more patients. Next slide, please. And the market that we're dealing in, the remote patient monitoring market, is forecast to be worth $85 billion by 2026, growing at 30% per annum. So we've got a huge market, and there's no shortage of growth available to us as an organisation. Next slide, please. The device, as I said, is unique. It is FDA approved. Nobody else has this but us. And really, to conduct remote patient monitoring in a respiratory environment, there's nothing really available but wheezo to be able to do this effectively. So this really gives us IP differentiation as an organisation, but also for the recently acquired Access telehealth organisation as well. Next slide, please. As I said, it's all underpinned by reimbursement. Our margins will increase almost tenfold. And the beauty of preventative medicine in the United States is that insurers really do understand the importance of preventative medicine in reducing their costs. A very different environment to Australia. Next slide, please. Next slide. We've covered this. Best practice. Now, Access telehealth is twice as good in delivering remote patient monitoring reimbursed solutions in the United States compared to the average. Now, that is world-class. That is something that is very attractive to potential clients, because fundamentally a potential client for Access will earn twice as much from remote patient monitoring using their services than they would from somebody else's. Next slide, please. So basically, we've got a team that can deliver this. The opportunity is huge. The acquisition of Access provides us with the opportunity to be able to have an end-to-end control over what's delivered. And, I've been in a position where I've done this in Australia. We secured cornerstone investment from a company called ResMed, who you might know, in my previous company called Healthy Sleep Solutions. And that organisation was ultimately sold to a French multinational called Air Liquide, a publicly listed organisation. And the business was built in remote patient monitoring in sleep apnea. So we've done this. We've got a well-versed chief of US operations employed in the United States. And we're really poised now to accelerate on the platforms that we've set in the United States over the last 18 months. Final slide, please. The growth drivers are there. These are things that are not near-term. These are immediate. As I said, the economics of this deal are tenfold better than we currently have. We have the growth opportunities not just within remote patient monitoring respiratory disorders, but also in other disease states, tripling the size of the market. And we've got a team that we know can deliver on this and have delivered on this in the past. So it's an exciting next 12 months for us. And it's great seeing Brian on board with us as well. He's got extensive experience with that. And thank you very much for your time and listening to me today.
Thanks, Marjan. As you've just mentioned, Brian has recently joined the board. Brian Leedman joined the board as a non-exec director who comes with his own healthcare experience. I might throw a question at Brian. He's been sitting there patiently listening and taking it all in. Why did you join the board of Respiri? What DD did you do, and what excites you about the company going forward?
Respiri was a company that I was familiar with during my time at ResApp, being another digital healthcare company on the ASX. And what really intrigued me about Respiri was that they achieved something that ResApp was unable to do, in that Respiri was able to get an FDA approval for their product. ResApp had 2 attempts to get FDA approval for its technology and failed. So I know how difficult that is to get FDA approval for a device. in the US. And so I was always a bit jealous about that Respiri was able to do that. And since ResApp was sold to Pfizer last September for $180 million, which was a terrific outcome for shareholders, I thought it was somewhat serendipitous to be approached by Respiri and asked to join the board. And I thought that, gee, that's a space I know a bit about, and I was quite keen to get back into it and sort of come out of a semi-retirement, I guess. And I think that this is a terrific opportunity with the FDA approval and the product that's unique in this space and remote monitoring of patients with such a huge illness such as asthma. It's just makes sense. And I think that one day, provided that we achieve in terms of commercialization, I think Marjan has certainly outlined in the process of happening now. I think that this company would become a very attractive proposition to the likes of a big pharma or big healthcare company in the US, and that wouldn't be.
Perfect. Thanks for that, Brian. Marjan, I do have a couple of questions for you. I'm just conscious of time.
Sure.
In terms of the hospitals signing up to the device and how you touched on it, how the SaaS model works, what are the sort of groups that have signed up? How big are they, and how do they fit into a bigger network?
Yeah, I mean, I touched on, thanks for that, David. I touched on Michigan Children's Hospital, who are part of the Detroit Medical Center. Now, the Detroit Medical Center is the jewel in the crown for a large organization called Tenet Health, a New York Stock Exchange listed. Their market cap's about 20 billion US, and they own over 60 hospitals across the United States with over 120 outpatient clinics. Now, they have made it clear to us that if we get, they said if, but I'll say when we get it right at Michigan Children's, that this is a huge opportunity for us to roll out remote patient monitoring across their entire network. Now, each hospital is its own set of rules and management, of course, but it would be mandated. Now, important to note that is a wonderful opportunity in itself, but the acquisition of Access Telehealth provides us with the utility to be able to roll out remote patient monitoring, not just with asthma and COPD, but also with cardiovascular, diabetes, and obesity, and be Tenet Health's one-stop remote patient monitoring shop, if you will. Let them focus on being and running hospitals, and let us be their extension into the community with remote patient monitoring. And to be honest, I could screw up everything else, but if I get Tenet right, we'll be in a very, very, very strong position. And I'm not for a moment suggesting we will screw up everything else, David, but it certainly is an opportunity of the magnitude that is very exciting for us.